patients come in for revision rhinoplasty, one of the most common things I hear is, "I just want my old nose back." And even when patients don't say that directly, or they intellectually understand that they can't truly get their old nose back, during the consultation it often becomes clear that the only result they can really imagine feeling good about is the nose they had before surgery. And that makes sense because rhinoplasty doesn't just change your anatomy, it can affect your identity, confidence, and the way someone recognizes themselves in the mirror. But the truth is that anatomically, the original nose no longer exists. The cartilage has been removed, reshaped, weakened, or repositioned. Scar tissue has formed, the skin has changed, structural support has changed, even healing patterns change. So revision rhinoplasty is not like pressing undo, it's a reconstruction. A revision surgeon isn't simply trying to restore a previous nose. We're trying to create the best possible nose with the anatomy that remains. Often we need cartilage grafts from the septum or rib because support is missing. Sometimes scar tissue or thickened skin limits what's surgically possible. And sometimes the biggest challenge isn't even surgical, it's that the patient is comparing every possible outcome to the memory of who they were before surgery. That emotional comparison exists even when they logically understand that the old nose is gone. So the goal of revision rhinoplasty is not to time travel back to your original nose. It's to restore harmony, function, and a sense of identity in a nose that has already been altered. And when revision is done well, patients can get a nose that finally feels like themselves again.